Hey everyone, today we will be talking about pain management, epidural versus natural birth. I will also discuss types of medication that your doctor will order while you're in the hospital, and a few other tips and tricks like always. So stay tuned and I hope y'all enjoy. Thanks.
Hey guys, my name is Denise. About 5 years ago, I decided to do a nonprofit organization to where I go to people's homes and I would help them out. As a nurse, you know that you don't get enough information or enough time to tell y'all everything we know, and I felt like I needed to do more. I've decided now to try to do YouTube videos because I feel that strongly about it. So welcome, and I'm glad to have each and every one of you. If this is not for you, I understand, but this is the knowledge I have and I want to give it to y'all. So the first thing we're going to talk about today is, should I get an epidural or not? That's always a big question. So if you have had, this is your first baby and your doctor saying, hey, we're going in for an induction, that usually means we're going to start ripening, and in the morning they're probably going to try to break your water, and you're going to be put on a medicine called Pitocin to make the contractions continue, and you're going to do that until you deliver. That is very hard. Not saying you can't do it. That is very hard because your body's never done it before. So if this is your second, third baby and your body knows how to do it, it figured it out from the first time. Usually if you have a baby within 4 years, you cut that time in half on when you have the baby. So say for instance, you delivered your first baby the next day after you came in the night before, they broke your water. Usually you'll deliver between 3 and 5, about 30 minutes to an hour and a half, usually sometimes 2 hours pushing. That is a lot of pressure and a lot of pain. Not saying that you can't do it, but what they don't tell you is if you have a repair, whether it was a laceration, a tear, a cut, a episiotomy, they have to sew that up. And there is not enough lidocaine, I believe, in that hospital for you to go numb. So it has nothing to do with naturally delivering. It is the pain afterwards. And then you have to think about that you have been in labor for 2 days. You probably didn't sleep the night before. You're exhausted. And now they're going to give you this beautiful baby and it's time to skin. And you're like, I'm so tired. I can't even hold my baby up because you've been holding your legs now for 2 hours, and you've been pushing and holding your breath and bearing down and doing everything you did, and you did it right, and now it's time to breastfeed. And this is where I see all the times my moms that go natural, they can't even hold their babies up. So dads or significant others are coming in and we're trying to hold that baby up and help them breastfeed. And so the best time, the most magical time of your birth of your baby, you can barely stay awake. You can't even hold him or her up. And you feel terrible because you can't, because you put everything you had into delivering that baby. So if somebody was to ask me, you know, should I get epidural or not? And I would have to ask them, what's more important? Breastfeeding and bonding with your baby or no epidural? So you need to decide. Breastfeed, no epidural, in my opinion. An epidural will allow you to relax. You usually get about an hour and a half to 2 hours of sleep, and then you're rested, and it allows your body to physically relax and allows that baby to drop. Because if you don't do your breathing techniques and you didn't go to Lamaze and you're not 100% devoted into this and you're not changing, you might think about an epidural. My first baby, I went in, I was already 4 centimeters, he broke my water, I delivered him in about an hour and a half. It was painful, but the delivery was not crazy bad. It was the repair. I ended up delivering without my doctor there. The baby shot out and I had a lot of repair. It's what they call, I had a 4th degree. It was pretty bad. He was 8 pounds. So I remember them sewing that up and I felt everything. And just the repair alone killed me. Afterwards, they handed me my baby. I went skin to skin with them, and I was in so much pain from the bottom that I really didn't even get to enjoy that, and I was trying to breastfeed and not knowing what you're doing for the first time mom, I felt like I had failed my child because I couldn't even focus on him and the beautiful aspect of him because of my repair hurting so bad. That's just something to think about. So it depends on how important it is for you to deliver a natural birth. And sometimes, you can honestly say, sometimes you get to a point where you're delivering and you're like, I can't do this, I need an epidural. So bam, you get an epidural real quick, the baby drops, here it comes, and then you're still exhausted because you want 2 days without laboring. So you need to make it up in your mind what's more important, delivering and be able to bond with your baby afterwards, or no epidural.
So moms, there are many other aspects to think about in regards to the natural birth, pain medicine, and bonding with your newborn. I just wanted to share these thoughts with you and maybe help you decide on your birth plan. So until next time, good luck, and you've got this.